Hello, my name is Peter McCormick, physiotherapist, Accident Emergency Department, Altnagelvin Hospital. Thank you for taking the time today to listen to this presentation on sprains and strains and how we can manage these problems. In our talk today, we will discuss what exactly a soft tissue injury is, what the healing process for soft tissue injuries are, what our early management aims for soft tissue injuries are, and how we can achieve this. And importantly, what are the barriers to normal recovery and what are the signs of a more serious injury? So what is a soft tissue injury? A soft tissue injury is an injury to structures such as your muscles, ligaments which bind bone to bone, tendons which bind bone to muscle, and bursa which are fat sacs in and around your joints. Soft tissue injuries can vary in intensity and severity, ranging from a very, very simple injury to a much more limiting injury. They can occur for a number of reasons. Things such as significant trauma, like a fall or a bang, can often produce a soft tissue injury, whereas overstretching manoeuvres as a result of sport can also produce many soft tissue injuries. Repetitive overuse of a joint, for example a shoulder, or for example things like our hands while typing and stuff, can also produce soft tissue injuries which take the form of a repetitive strain injury. In some cases, as a result of a significant ankle injury, some tiny bits of bone can be pulled off as a result of a significant ligament sprain. This is regarded as also being a soft tissue injury, even though there has been a small avulsion of the bone. The important thing to remember about soft tissue injuries is that their healing can take between 6 and 8 weeks. Common features as a result of soft tissue injuries are pain, swelling, loss of movement, loss of function, and often bruising. The process of soft tissue injury healing involves 3 stages: the inflammatory phase, the proliferation phase, also known as the repair phase, and the remodeling phase. These are not distinct individual phases, and there is quite a lot of overlap between each phase. As a result of a soft tissue injury, the body releases chemicals such as histamine and serotonin, which cause the blood vessels in that area of damage to open. This increases the blood supply to that area and increases local swelling, which causes pain. Another cause of pain at this early stage after injury is a result of some chemicals which are moved into the area. Chemicals such as bradykinin and prostaglandins cause chemical irritation of the damaged structures. In the inflammatory phase of healing, the body tries to address this issue of bleeding. It does this by forming a blood clot at this area. This blood clot helps to seal the damaged area, stopping the bleeding, and acts as a scaffolding which new healing can link onto in later days. This scaffolding is fairly weak and is easily damaged, so a key theme of the inflammatory phase is protecting the area of damage. This phase of recovery lasts from around about the point of injury to about 7 days after injury. Also occurring at this stage is that the damaged soft tissue are being broken down to provide a good environment for new healing to take place. The inflammatory phase is regarded as the most painful stage of our recovery after soft tissue injury, but it is a vital phase. Without it, our overall healing will be very slow. This is why at this stage, using anti-inflammatory medication too soon after injury especially in the first 3 days, can slow this process right down and delay your overall healing. Our treatment goals at this stage of inflammation are to protect the area from further injury, to reduce our swelling, and to reduce our pain. As mentioned earlier, protection is the key theme of the inflammatory phase of healing. Two important things to remember in terms of protection are reducing activity levels and not pushing yourself to the point of pain. These are important things to remember in those first few days, especially the first 72 hours after injury. Protection can take many forms. For lower limb injuries, this can take the form of crutches or strapping or protective elasticated bandaging. And for upper limb problems, it can take the form of slings or splints. But all of these are aimed to try and limit further injury. As stated earlier, the body has lost its strength in the area of damage, and the early scar which is starting to form is very, very susceptible to re-injury. The amount of protection required from one person to the next is not standard. It very much depends on the severity of injury. For example, one person after an ankle sprain may find that their walking pattern is not particularly affected, whereas another person may find that they need the assistance of crutches to walk. But overall, with both of these extremes of injury, the aim is to avoid not moving the area at all. Even with protecting an area, we can still allow a bit of gentle movement to take place without causing any damage. Remembering not pushing into pain is the key. From about 2 days after injury, the second phase of healing begins. This is called the repair or proliferation phase. The main feature of this stage is that a scar forms at the area of damage. This scar is a result of collagen formation, and specifically type 3 collagen. Unfortunately, type 3 collagen is fairly weak and inelastic. To encourage collagen formation in the area of damage, i.e. a good scar to form, what we're looking for is gentle movement and gentle use of the area. It has been shown that people who allow the area to move and allow gentle use of the area at this stage of our healing have better levels of recovery and a better quality of healing than those who are overly protective of their injured area. This healing stage continues to about 6 weeks after injury and reaches its peak in and around the 3-week mark. Our goals at this stage of our healing is to increase the movement and to try and use the area as normally as pain allows. The final stage of healing is called the remodelling phase. This begins about 2 to 3 weeks after injury. For most of us, full recovery after soft tissue injury takes about 6 to 8 weeks. This remodelling phase, however, is carrying on in the background for many months after injury. And what it's ensuring is that we've got a strong scar. It achieves this by causing the production of type 1 collagen, which replaces the type 3 collagen that we mentioned earlier as being very weak. This type 1 collagen is much stronger and is more adapted for our normal day-to-day activities and demands of our tissues. Our goals for this stage of our recovery are to get back to normal levels of function, for example, work or sport. This has to be done in a graduated way. There are a number of elements in how we can manage soft tissue injuries, particularly in the early days after injury. One important concept to remember is that of optimal loading. Loading basically means how much we use the damaged area after injury. If we overload the area, in other words, if we use the area far too much, we increase the risk of re-injury and we increase the risk of increased levels of pain. Whereas if we underload the area, we can contribute to tendon weakness and also slower rates of healing. So the key is to find a happy medium between the two. One important element to help us find this happy medium is that of pain. While we do expect slight discomfort after injury, we shouldn't expect our increasing levels of activity to add to severe pain. So what we try and do is we accommodate our loading levels to that of our pain. If our pain levels are comfortable, then we can gradually increase our amount of loading. But we must remember to avoid prolonged periods of rest. Optimal loading has an added meaning for lower limb problems. For lower limb problems, obviously we have to begin weight bearing, and the aim with soft tissue injuries is to try and start weight bearing as soon as possible. In some severe cases of injury, patients will require the use of crutches or another mobility aid to help them regain their mobility. And then, as pain levels improve, they can progress off these mobility aids. This is optimal loading. For upper limb problems, encouraging activities such as washing, dressing and writing as soon as possible, again, is a good example of optimal loading. Many of our patients decide to use ice after injury. The use of ice has proven to be slightly controversial in recent years, as changing evidence indicates that ice is not particularly effective for the use of swelling after soft tissue injury. The evidence does, however, suggest that ice is particularly effective as a form of pain relief in the early stages after injury, probably best used in the first 24 hours after injury. And it's maybe this pain relief which is produced by the ice which helps the person to allow their limb to start moving, which actually helps with the swelling. Prolonged use of ice for quite a while after injury has actually been proven to slow the rate of healing, so this is discouraged. If you do use ice, we tend to recommend that you should wrap your ice up in a damp towel. For example, using a bag of frozen peas wrapped up in a damp towel applied to the limb. The recommendations would be that you should use it for probably about 10 minutes at a time. Remove it, check the injured area for any signs of irritation, and then reapply for no more than another 10 minutes. And that will be as much ice application as would be recommended. It is very important to remember that you should never apply ice directly to the skin, for this can cause something called an ice burn, which is a very painful condition and can lead to damage of the tissue. The use of compression is commonly seen following soft tissue injuries. Often patients have things like tubie grips applied, arthropads, which are for knee injuries, and, for instance, ankle strapping applied after ankle sprains. If we take the example of ankle strapping first of all, ankle strapping, although provides good support in the initial few days after injury, by about 4 or 5 days after injury, it is beginning to lose its integrity and should be removed at this point and probably replaced with something slightly firmer like double thickness tubie grip. Tubie grip and arthropads are basically elasticated support bandages which help to provide support to the area in the form of compression. This compression helps to keep a lid on the swelling in the area, and by controlling the swelling, we are helping the pain levels and also reducing stiffness in the damaged area. The use of compression in the form of arthropads, tubigrip or strapping is very effective in the initial days after injury to facilitate weight bearing. Not only does it provide compression, but also it helps reduce pain levels, gives the patient a sense of support, and also improves their confidence when they're on their feet. It is important to realise that use of tubigrips and arthropads should not be worn in bed at night, as they can impair circulation, especially when worn for prolonged periods. Another important element in the management of swelling after soft tissue injuries is that of elevation. This basically means using gravity to help remove swelling from the damaged area. As we know, if we've damaged our knee or our ankle, swelling will track further down the leg. So if it's a knee, you'll get swelling into your calf and ankle. If it's an ankle, you'll get swelling into the rest of the foot and the toes. If it's a wrist injury, you'll often get swelling into the fingers. And obviously, persistent swelling can add to stiffness and pain. If we can get rid of some of this swelling by elevating, this will obviously help the pain and stiffness. This person in the picture here, you can see, has had an ankle sprain, and what they're doing is they're elevating their ankle by using 2 pillows underneath their lower leg. By doing this, they have positioned the ankle higher than the knee and the knee higher than the hip. This creates what we call the drain pipe effect, allowing the swelling to track down the leg towards the hip and groin where it will be dispersed. An added factor which may help in this dispersion of the swelling would be some gentle movement at the damaged area. This can be gently moving the foot up and down to create some muscle pump which can move this swelling away from the damaged area. This could also be the case for a damaged wrist or hand by simply encouraging some simple movements of the fingers in towards a fist and out. You're also achieving some muscle pump which can help with the circulation and the removal of swelling. For upper limb elevation, it's really only injuries around about the hand and wrist and fingers which would benefit from elevation. And this can be achieved by placing the injured arm on the opposite shoulder. This means the hand and wrist is higher than the elbow and the swelling can track down the arm. Whenever I'm encouraging patients to elevate, and it usually is for lower limb patients, I would usually say about half an hour's elevation regularly through the day can really make a big difference in terms of pain levels and stiffness. And also I tend to encourage patients with lower limb swelling to stick a couple of pillows underneath their lower part of their leg at night while they're sleeping. And this means they're allowing that limb to be elevated while they're resting, which really enhances the amount of swelling removal. Again, through the day there's no problem combining elevation with compression, but again at night time, remember, compression should be removed from the damaged area. Another important message to remember in the early days after soft tissue injury is the no harm principle. This is vital in the first 72 hours after injury. The no harm principle means avoiding the use of heat directly to the injured area, the use of alcohol, running or any other vigorous form of exercise, and direct massage to the damaged area. These are important things to avoid as they can potentially add to further damage and pain. Heat and alcohol will increase local blood supply to the damaged area, increasing swelling and increasing pain levels. Exercise will increase the risk of further injury and add to pain levels. And direct massage to the area, as well as potentially increasing pain, can also damage the immature healing which is taking place. So what else can you do in those days following the first 72 hours after injury? Well, there's a number of things that you can do which can certainly help your condition. Firstly, if you've been advised regarding simple exercises to get your damaged area moving, this would be a good time to start them from 72 hours after injury. After 72 hours, some gentle massage to the area can also make a difference. Again, this can take the form of self-massage, you trying to help yourself, or for awkward areas, for instance ankles and stuff, you could probably get a family member to assist you with gentle massage with your leg in a slightly elevated position. Always with massage, we're trying to move swelling away from the periphery, i.e. the ankle or the knee, towards the groin area, or if it's an upper limb problem, we're trying to move swelling away from the wrist and elbow towards the armpit area. Medication can certainly make a difference after the first few days following injury. Liaising with your local pharmacist regarding pain relief and or anti-inflammatory medication, if that's appropriate to you, can certainly be useful. If further clarification is required regarding medication, certainly trying to have a chat with your GP can also be useful. It's very important to remember that with upper limb problems, trying to avoid that protective positioning of the arm with the arm across our body as things start to improve. So what we're trying to achieve here is we're trying to allow patients to allow their arm to rest by their side, or even reciprocally swing as they're walking. For lower limb injuries, for instance knees or ankles, we want patients trying to adopt a normal walking pattern as soon as possible. We often see patients walking on a bent knee or walking with a stiffened straight knee, and both of these patterns are to be avoided if possible. When we discuss walking with patients, we always try to encourage them to try and get their heel to the ground first, then allowing their weight to transfer over their foot before they roll onto their toes. This pattern of heel strike, full foot weight bearing, and then toe off is really important to help normal mobility. We find that whenever we're heel striking, our knees are straight, and as we roll our foot into that toe off position, our knees bend. And these patterns are really appropriate when we're trying to normalise walking as soon as possible after injury. So just a quick summary of what we've learned so far. Good management of soft tissue injuries, particularly in the early days after injury, can help to reduce the amount of tissue damage, can reduce our pain levels, can prevent problems such as prolonged inflammation, and can protect the damaged area from re-injury, as well as promoting new healing, and help us to get back to decent levels of function, including work and sport, in shorter periods of time. Unfortunately, there are factors that can delay our rate of healing after soft tissue injury. Some of these relate to lifestyle, while others relate to aspects such as our general health. If we take, for example, things such as smoking, it is well documented that healing rates among smokers tend to be a lot slower compared to non-smokers. This is most commonly seen following bone fracture. Smokers also tend to have increased pain levels, and this may be a result of increased nervous system sensitivity, possibly caused by some of the chemicals associated with the cigarettes. Alcohol, we've already discussed earlier in the presentation. When used in the first 72 hours after injury, this can increase the amount of inflammatory hormones within our body and add to pain levels. Other aspects for us to consider are things like our general health. For example, diabetics have a very slow rate of healing, and this will also be demonstrated following soft tissue injury. Other conditions, such as fibromyalgia and other associated rheumatological conditions, can also demonstrate slower rates of recovery and also increased levels of pain following injury. Three significant barriers to our recovery, which we should strive to minimise, are stress, anxiety, and fear of movement. As we know, after injury, pain is a normal reaction. Pain works to protect us from further injury, particularly in those first days following injury. However, when we are stressed or anxious, this tends to further increase the amount of inflammatory hormones in our blood, which adds to pain levels. But also, when we tend to be stressed, we become overprotective. This means we begin to anticipate pain before it happens, and we try to protect ourselves from being more functional in our day-to-day activities. This feeds in to fear of movement. And once we start to establish a pattern of becoming more restrictive in what we're doing and not moving things or not weight bearing, before long this process becomes very hard to unlearn. So this is why as soon as possible after injury we should try and be positive. We should try and minimise the amount of stress or anxiety we are feeling. Be confident about our recovery. Because the more we allow ourselves to try and start getting things moving, the quicker our recovery. It is very important to realise at this stage that just because we're feeling some pain when we're doing simple everyday tasks doesn't mean we're causing any more damage. Remember, we're slightly sore anyway. It's likely that we have slight increases in pain with general activities, but this should not be excruciating. On this slide, we can see a pain indicator dial, and certain factors can influence how high we are feeling our pain and how low we feel our pain. So factors which can reduce our pain levels include being positive about our recovery, having good periods of rest, allowing the area to move early after injury, starting to take some weight through our damaged limb as soon as possible, for instance allowing ourselves to walk as early as possible, and not putting too much pressure on ourselves, okay, like trying to get ourselves back to sport or back to work in unrealistic time frames. If we're doing this in an unrealistic way, we are not pacing ourselves, and by not meeting those goals that we have set ourselves, then we're causing more anxiety, which feeds into more pain. Factors which can make our pain worse are just the opposite of what we've spoken about. So tiredness. Again, if we're tired of not getting enough rest, that can increase pain levels. As we've spoken about, if we're anxious or afraid or overprotective of moving the area, then we can hold ourselves back in terms of healing and add to pain levels. And sometimes doing far too much can be as bad as doing little or nothing. Because once we're doing too much, then we get a massive flare-up of our pain levels, and that can set us back. Occasionally patients are diagnosed with what seems to be a simple soft tissue injury, for example a sprain or strain. However, this turns out to be a much more complex condition. For this reason, we tend to advise our patients of some aspects that they should be aware of, which may indicate a more severe injury. And if any of the following aspects are noted in terms of their recovery, they should consider reattending A&E for a review of their condition. These factors include severe pain which is not settling, even up to 10 days after the point of injury. Severe swelling which is not settling. Now, ankle swelling is expected after the likes of an ankle sprain and is likely to persist for a period of sometimes months after injury. However, swelling after ankle sprain can fluctuate. We tend to find that when we go to bed at night and elevate the leg overnight, that our swelling levels should be reduced in the morning time when we get up. And then after a day's activity, swelling tends to accumulate. That's normal. However, if we find that there is no change in our swelling despite practices such as elevation and compression, then we should certainly think about getting some advice on that. We should also be quite clued in on swelling affecting our calf. Any hardness, redness, swelling in the calf should be carefully scrutinised. If this is accompanied by things such as tenderness and increasing pain when we draw our foot towards us, we certainly need to be going to A&E to get ourselves checked. In some cases, after acute soft tissue injuries, when we're not up and about and mobilising as much as normal, there can be a chance that we can develop a clot. And hardness, swelling, redness and pain on palpation in the calf area can sometimes indicate the presence of a clot. Other factors which need to be considered for further attention if they are being demonstrated are an inability to bend or fully straighten the knee. Again, after knee injury, we expect some restriction in our movement, but we do also expect that this should improve, certainly by about a couple of weeks down the line from injury. If no further gains are being made in range of movement, again, further attention should be sought. Likewise, if you find you're unable to weight bear or walk, even with the benefit of crutches, again, following knee or ankle injury, certainly further advice should be sought. For upper limb problems, an inability to raise the arm, again, maybe a couple of weeks after injury, can indicate the presence of a more significant muscle injury. And again, attention should be sought. Don't worry so much about simple cracking and clicking at our joints. All of our joints do this to some degree. However, if there's significant grinding or movement felt within our joint with associated severe increases in pain following an injury, again, this isn't a normal pattern and further advice again should be sought. So hopefully you'll have found the information provided in today's presentation useful. I would use this as a guide and a reference point over the next few weeks to help your ongoing recovery. We expect the vast majority of the acute soft tissue injuries that we see to fully recover. However, this may take up to 6 to 8 weeks. So after the first few days or the first week, you're still a bit sore on it and maybe you haven't seen as much progress as you would have hoped. Don't lose heart. Stick with it. And certainly by about 10 days to 2 weeks, you should be progressing a bit better. And that should give you more heart to continue on with the advice and exercises that you've been directed to. If you haven't been directed to any specific exercises to date, you may find a link at the end of this talk specific to the area that you have injured, and try some of these exercises and follow the instructions as directed. If after 2 to 3 weeks down the line you're showing no signs of improvement, well, you can consider getting some further advice, either from the physio department directly on 02871 345171 extension 216302, or you can have a chat with your GP, or if any of the factors that we have asked you to keep an eye out for occur, you can directly reattend accident emergency. Thank you. For further advice on the following areas of injury, including early exercise programs to help your recovery, please follow the link provided.